Hi, everyone. I'm Michelle Jobin, and you are listening to Time to Talk, a podcast for caregivers. This podcast is dedicated to helping family caregivers in Ontario. Through expert tips and resources, you will gain knowledge and validation for the ups and downs that come with caregiving. More importantly, you'll learn that you're not alone. It's so important to take this time for yourself. We're glad you're here. Today, we're speaking with Craig Thompson, Patient Ombudsman of Ontario. With over 30 years of leadership in healthcare, Craig brings invaluable insights into complaint resolution, self-advocacy, and positive systemic change. Craig, thank you so much for being here with us today.
Oh, my pleasure.
I wanted to really have this episode where we got the chance to discuss this because the concept of patient advocacy and caregivers advocating for patients and patients advocating for themselves is such a big topic that comes up when I'm speaking to caregivers for the podcast. So I thank you so much for taking the time today. We really want to create this space on Time to Talk where Ontario caregivers can connect and share. And I really think they're going to get a lot out of our conversation today. We really want to delve into this pivotal role of the Patient Ombudsman's Office and genuine dedication to improving healthcare for everyone.
I look forward to it. I have to be honest, I come to this work with a background as a caregiver and as an advocate for a patient voice. So I feel I come with a passion for this kind of work that really I hope finds its way into the work that we do.
Well, we thank you for that. And I also have a background similarly in how I found my way to this podcast experience as a caregiver as well. So it's why I'm passionate about having these conversations because it's something that affects so many of us. Can you talk about and describe the core responsibilities of the Patient Ombudsman's Office and its role in resolving complaints within Ontario's healthcare system?
Sure. So we are mandated to receive and try to resolve complaints from patients, residents, and caregivers about negative healthcare experiences that they would have had interacting with Ontario's healthcare system. So that's fundamentally the work of an ombuds in general. So the work that we do is not unlike other ombuds offices that might not be in other sectors, whether it's an organization that has an organizational ombuds. We're in the complaints business. And we also function as what's called an office of last resort. And all ombuds function in this way. And what that really means is that our office is set up to take those complaints where you've been unable to get to a resolution by working with the organization that you have the complaint about. So that's fundamentally a core part of how we do our work. And that makes sense on so many levels because I think intuitively know that the best kinds of resolutions occur when you're able to deal with the individual or the organization that you had the initial problem with and give them a fair chance to understand your concerns and to work towards some kind of resolution. It's only when that breaks down or you're not satisfied with the outcome that you would then have the option to come to our office, and that's why we're called an office of last resort. There's a couple other things that we try to be careful of before we take a complaint, one being if it's about an area of the healthcare system that we do not have jurisdiction over, and which is we do have jurisdiction over quite a bit of the healthcare system. So if it's involving a public hospital, long-term care home, home and community care, and most recently the community-based surgical and diagnostic centers, that is our jurisdiction. But if it's about a complaint that is maybe from about a retirement home or public health, that is not our jurisdiction. But we do our best to connect people with the organization that might have that oversight. So that's fundamentally, we're in that complaints space of trying to help people get to a resolution when they couldn't in working with the provider or the organization. We also do, on top of that, investigations. And so if a complaint is something that's maybe a little bit more complex, or it's about an issue that we feel strongly there's a public interest and the whole system would benefit from us doing a bit of a deeper dive on it, then we can go forward with an investigation. And that allows us a few more powers to be able to get to the root of the situation. But also we get to make formal recommendations to an organization, and that just gives us a little bit more leverage to see if we can get those changes to be put in place.
When we're dealing with a subject like healthcare and caregiving,
these are related to very heightened moments in people's lives, very, very deeply personal and in sometimes challenging situations in people's lives and the lives of their loved ones that you might be talking to you. So I can imagine that you're dealing with a range of situations, but that are all, deeply important to the person that you are speaking to. How does the Patient Ombudsman Office ensure an impartial resolution while working with both complainants and health organizations?
Well, you've touched on a very important element, our foundational principle of ombudsman, which is the impartiality piece. And that's an important point that we always make sure that complainants understand, is that while we are advocates for fairness and a fair process and being fairly treated, we're not advocates for patients or caregivers, and we're not advocates for the health sector organizations. We're very much an impartial organization that works between two parties to get to a fair resolution. So what that means is that we will go to great pains to, and as you said, these are complex situations. And the types of complaints that we will get are ones that could not be resolved to the satisfaction of the complainant. So they're multidimensional. They can involve multiple organizations. Very much involves sometimes traumatic events. It can involve harm, death. It can, so they're certainly heightened emotions. But we work very hard to listen to both sides. And so we'll spend a lot of time working and listening to the complainant to understand what went wrong, what they feel is important, what resolution might look like. And then we'll spend same amount of time with the organization to get their side of the story. And by working, with both sides, we get to that middle ground, which is where the fair resolution occurs. And that's how we as an organization get to that decision that we've reached a fair resolution, because we're in balance. We're balancing the interests and the perspectives of both parties. So impartiality is really important to how we work. It also goes hand in hand with our independence as an organization. We are not, while we're funded by the Ministry of Health, we are not directed by the Ministry of Health. And so all the decisions that our office makes as to what we pursue, what we don't pursue, how we go about our work is made by myself and my team. And everything that we do is confidential. So we only ask for the information that we need to make a decision. And we also entirely private and confidential process. And that just, reinforces the relationships, recognizing that we're dealing with very personal information, personal experiences, and allows us to be able to have those frank conversations as to what went wrong and what might be a way to resolve those issues.
I can imagine that it's possible that some of the issues you might hear, while they're also very individual stories and complaints that you're dealing with, there might be some that are recurring complaints or issues. So in what ways does the office actively engage in preventing these sort of recurring issues that you might hear about in complaints and influencing positive changes in Ontario's public hospitals and, as you mentioned, long-term care homes and other healthcare facilities?
The idea that, through complaints that we get a sense, or we get insights into trends or things that are going wrong across the system through those complaints is an important concept of what directs our work. But ultimately, resolving complaints is important, because we want to make sure that those individual experiences are resolved to our satisfaction, and hopefully to the satisfaction of the complainant and the organization. But we also don't want those same experiences to be incurred by somebody else. And that's often what people will say to us when they come to us, is they may not be looking for much more than to say, you know what, I just don't want this to happen to somebody else. It's been hard for myself, my family, my loved one. I'm happy to engage in this resolution process, but if it doesn't get to if I don't get satisfaction, that's not the most important thing. And we do that, first of all, in our day-to-day interactions with the complainant and organizations. We are raising awareness within those organizations of where things can go sideways, and where what might not have seemed like an obvious issue in terms of process or a decision or a policy can lead to unintended consequences for a patient or caregiver. And so that's what we highlight. And in our vernacular of an ombuds, we shine a light on those things, these unintended consequences of what is, thought to be a really well-developed policy or practice actually doesn't work for all people. So every time we engage with a health sector organization, we are raising their awareness. So hopefully that doesn't happen again to another individual. So we've been open now in our 8th year. And so we've got a body of work of these circumstances where through, imperfect policy writing or through unintended actions or inactions by an organization, there's been a negative outcome. We have a sense of what's working and what's not working. And so we share that through a variety of ways with the sectors so that they understand what we're hearing in complaints. So we issue every year an annual report. It's fundamentally our key document that not only talks about the numbers in terms of, and also the data, because we're very much an evidence-based organization from the standpoint of complaints, but it also tells the stories. And that's really fundamental to ombudsman work, is that we can talk about the data, we can break down a complaint into its component parts and talk about the nature of complaints, but we also need to tell the story that sort of creates the image in people's minds of how these things happen, and so they don't happen again. So we issue an annual report every year. We're now in our 8th year, so we have an 8th year annual report coming out. We also do investigations. Those are more formal undertakings by our office. They deal specifically with 1 or 2 key issues. So through those investigations, we are dealing very intimately with an organization at a very interactive level, trying to understand what went wrong and what are the opportunities for resolution. And we make formal recommendations. Those formal recommendations are then published publicly for the benefit not only of that organization, but for all organizations of that sector, and even outside of that sector. So what we've learned is that what's good for an organization from the public hospital sector can be good for another organization in long-term care. There's a lot of commonalities in the delivery of healthcare. So through those investigation summaries, we're sharing it with the whole sector. We also learned that even with investigations and annual reports, we still need timeliness in terms of what we talk about. And so we have issued over the years what we call special reports. And these are really, if you're looking for something good that did come out of the pandemic, our issuing of these special reports was one of those things, because we knew we couldn't wait for an annual report to talk about some of the things we were hearing coming out of particularly long-term care. And so we issue formal reports and special reports. We've done 3 on COVID. We also do a new series of resources called Fairness by Design, which is really a way to look at complaints as a way to get ahead of future complaints by being proactive. So using what we've learned to design better processes, better service delivery models, better healthcare experiences, so you don't get the complaints. And just to go back to your point you made earlier, we want more complaints is good. It means a healthy healthcare system. We just don't want the same complaints. And so that's what we're really careful of, is if we keep seeing the same complaints, then we try to go deeper to understand what's going on there. And that means that we've got more work to do to make sure that the sector understands what the real issue is.
That makes so much sense to me, that more complaints is not a bad thing. It's a good thing, because it's more information for you to work with. And I love the fact that your organization has a proactive approach. We exist so that we can anticipate and perhaps eliminate further issues and problems. So I do love that approach. You did mention before that there are some sorts of institutions that fall outside of your jurisdiction. So what types of complaints in total, if we could just go over that a little bit again, do fall outside the jurisdiction of the Patient Ombudsman's office, and how does the office guide individuals with their concerns if they are beyond your scope?
So yes, we do receive a number of complaints that are about organizations or healthcare experiences that are not covered by our mandate. And we have to be very careful to stay within our lane when it comes to jurisdiction, because there could be another organization that has jurisdiction over that, and that would not be appropriate for us to be involved. So in those circumstances, while we do have a big portion of the healthcare system, if it's a complaint about the clinical judgment or the professional conduct of a regulated healthcare professional, so that we're talking about doctors, nurses, occupational therapists, and so forth, that is not our jurisdiction. That is within the jurisdiction of the colleges under which they're regulated. So if that a complaint came in to us about that specifically, then we would provide the individual with the information about which college is appropriate for them to reach out to, and then it would be their responsibility to reach out to that organization. We don't do that on their behalf, but we'll certainly make sure you've got the information you need to make that complaint. As I think I mentioned earlier, there's a couple areas, like retirement homes is not an area of jurisdiction for our office. So if it's about a retirement home, there is an oversight agency that has responsibility for them, and we would give that referral to the individual, and then they can contact that organization. It's not always a clear-cut case as to what's within jurisdiction and what's outside, from the standpoint that a healthcare experience can bridge many sectors. So you could have started your healthcare experience in primary care, which led to an interaction with an acute care setting, so a public hospital, and you may end up in a rehabilitation type setting. So those are three different sectors, two of which, one of the for sure is in our jurisdiction, which is public hospitals. The rehabilitation could be within our jurisdiction if it's attached to a hospital. So in those situations, we will listen to the whole complaint to understand all the different elements of it, and if we can, we'll peel away those areas of the complaint we can't deal with, make a referral to the individual so that they can take it up with another organization, and then move forward with what we can. Unfortunately, there are some areas of Ontario's healthcare system, like community mental health and addictions, public health, that don't belong to anybody's jurisdiction. So they're not the jurisdiction of our office. They're not the jurisdiction of the Ontario Ombudsman. There's really no other oversight agency to help deal with or to act like this Office of Last Resort role that we have. And we continue to bring that to the attention of the government, because it really does a disservice to caregivers, patients, and residents when there isn't an organization that they can fall back on like ours in those circumstances where they're not getting to a satisfactory resolution. So there is that work that we do. We call it sort of the navigation work, to make sure that you're speaking to the right organization. And a lot of times it is us, but sometimes it's not, and we will do our best to connect them with the right organization.
I think our listeners will be very happy to hear that, because one of the hardest things when you're involved into sort of most of our interactions with the healthcare system are not necessarily something we plan in advance for. So we just find ourselves in a situation as a caregiver or as a patient, and then suddenly there's a lot to untangle. So it is good to know that even if your organization is not necessarily the last stop in terms of who they need to talk to, at least you can help, as you say, navigate them in the right direction. So let's have a scenario where, for example, what would be a situation where a caregiver might need to file a complaint, and when does it experience reach this level, and what could be done before this stage? So how do we know as caregivers we're at the point where we need to file a complaint?
And that's also, that's a very sometimes difficult thing to determine whether you've actually reached, the point where an office like ours is appropriate. And I'll just say right off the top, if someone is struggling to understand whether they've reached that point, or what some of their options might be, because they've tried to raise an issue and they're not either getting any uptake by the organization, or they're not feeling like they're being heard, or they're just not getting the resolution that they feel comfortable with, please call our office. There's nothing, it's a phone call away to be able to ask a question that may save you some time. And we do a lot of that work of just making sure that we understand, what it is that you're trying to achieve, and what's the issue, and then we can do our best to help you to navigate the system, because you said complaints process, the healthcare system is complex. The complaints process is even more complex. Sometimes people have thought they've made a complaint in a formal way when they really actually have not, because they haven't followed the strict guidelines about what it means to make a complaint. And so that can be very frustrating, because you think you've been raising this with, let's say, for example, if it's with a nurse in a hospital, and you think, well, I've told the nurse multiple times about the care of my loved one, and nothing seems to be changing. That's actually really not the formal way to begin engaging with that hospital. It's through their patient relations department. And so that's an important thing to understand, has the complaint actually been made in a way that that organization then knows that they've got a complaint and then can begin to take action against it. And so we get those calls all the time, and happy to answer people's questions about that. But I mean, the other thing about in terms of what kinds of complaints, or at what level of acuity, if you want to call it that, of a complaint, that's a hard one to tell too, because every experience is quite individual. A situation where someone's frustrated with a billing process that's going on with, say, a hospital, could mean one thing to me and quite another thing to another individual. In terms of where they are in their life, what are the different demands being put on them, in terms of what that could mean in terms of the potential impact. And so what may be something, just a frustration to someone like to me or someone else, can be really life altering for another individual. So there's no bar to set as to what makes for, it doesn't have to be egregious. It doesn't mean that someone needs to have been harmed or to have to the point of even death. It really is very individual. So that it really, from that standpoint, we really rely on people to sort of tell us, this is what this means to me. This is what I've tried to do, and this is the impact it's having on my life. And then we get to have a chance to be able to determine if it's a complaint we can help with. So that's what makes this work interesting, but it also can make it really challenging and frustrating for complainants. But one of the things that I said off the top, and again, one of the fundamentals of good complaint resolution is you give that organization or the provider a chance to know that you've had a problem, and a fair opportunity to try to resolve it. That's really fair. That's only fair. It also makes for the best resolutions. I often say that the work that we do is really in either maintaining or strengthening relationships. We never want to get involved prematurely, because that can be very disruptive to a relationship, particularly a relationship with a healthcare team. If we suddenly, come roaring in, we don't roar in, but if we get involved, it can really kind of short circuit the process. So we want to make sure that it's had a chance to resolve itself before we get involved. But again, sometimes it's hard to determine have I reached that point or not. And again, I say, just, if you feel you're sitting on the horns of a dilemma as to whether we're the office to call, then just call the office.
Are you a caregiver in Ontario looking for information, advice, and support? Managing Care is an online resource that can help you connect with other caregivers and provide you with helpful resources, such as respite services, financial support, and more. With Managing Care, you can receive invaluable support and guidance to make your caregiving journey easier. Visit ontariocaregiver.ca to learn more. And now, back to our episode.
That's reassuring, because at least your organization can weigh in, at least if this is something that does need to be further investigated. So if we are at the status where a complaint is filed, what specific actions does the office take in terms of review and information gathering and collaboration with complainants and health organizations? I'm assuming, again, this varies based on the situation, but could you give us some sort of idea? Because I'm assuming, and you sort of touch on this, it's not exactly a short process. There is a lot of information that probably does need to be gathered.
Yeah, there's no two complaints are the same. And in terms of duration, sometimes they can be quite quick, because there's just by the nature of the complaint, it could be something that either we've seen before and can be dealt with quite quickly. Sometimes it's a situation where what we can do what we call a courtesy call, which essentially is we, with the consent of the complainant, we will reach out to an organization and just try to understand what might be going on. And sometimes that can be enough just to unstick the problem that's occurring. But there's always a back and forth of sharing. We gather information. We want to understand what's happened. We'll ask a lot of questions. That really is fundamentally the job of an ombuds, is to be curious, which means if you're curious, we're going to ask a lot of questions. And so we will ask a lot of questions of the complainant at the front end to understand, the nature of the complaint, what transpired, what are the things, what was the impact it had on their life, and what they might be looking for in terms of a resolution. And then we will use that information to get a sense of what we're dealing with, and then we'll reach out then to the health sector organization. And typically we get the consent of the complainant before we even initiate that process. And we will do the same thing with that organization. If it turns out that it's the first they've heard about this complaint, it's never, it's new to them, then that can be then a rather quick resolution, because essentially we're just reconnecting that complainant to the organization. They now know that there's something that's gone wrong and somehow it fell through the cracks, and that can be the end of it from our standpoint, and that then will run its course with the organization. But if not, and they know about this complaint, and they've tried their best to try to get to some kind of resolution, then we will again start asking questions. And then we do, which is sometimes referred to as like the shuttle diplomacy piece, where it's a back and forth between the complainant and the organization to gather more information, get a better idea of what's happened. And then we'll gradually be moving towards a framework for what we think is a fair resolution. And I think that's an important distinction to recognize, is, as I said off the top, we're not an advocate for the caregiver or the patient. We're not an advocate for the organization. We are impartial in that we will try to get to what we feel is a fair resolution. Ultimately, that can satisfy all parties. It can also satisfy none of the parties. But our role is to be kind of some determination as to what's fair, and that's the decision that we try to get to. So at that point, if we can actually get to a resolution, then that's always documented in writing. Our office is very firm on putting onto paper what it is, how we understand the complaint, what the issues are at play, the interactions that we have with the organization, and when we close the file, we will put into those communications the reasons behind our decisions. And then that gives people and the organization a bit of a paper trail as to how we came to arrive at that resolution. There's a lot of that back and forth, and as the time can be quite short, it can be quite long depending on the complexity. Recognizing that over the course of doing the resolution, things change. It's healthcare. Mm. We're dealing with people's health, so things could, change quite dramatically. And so we're always asking complainants to keep us informed of what's changing, and particularly if your case has been put in, has not been assigned as yet to one of our early resolution specialists, then and something's changed, we encourage people to make sure that they reach back out to us to tell us that something has changed, so we can do our best to adjust to it. Whether it means it's no longer an issue, which happens quite often, or something's changed and there is more jeopardy for the complainant or their loved one in that circumstance. So that's really the nature of how the work goes between our office and the complainant.
I get a sense that you're navigating these complexities by, again, that sort of North Star of your business, that you stay impartial and that you collect as much information as possible. That seems to be the best way to do things. I want to talk about cases where we decide that an investigation, or your office decides that an investigation may be required. And I wanted to get some clarity on what is an own motion investigation when that is launched. Can you tell us a little bit about that?
Yeah, so investigations is another part of the work that we do. It's more in-depth investigations of a particular issue or care experience that we think has broad public interest, has the ability to impact systemic change across the system. An own motion investigation is a unique type of investigation, and it's specific to ombuds in that we can, or I can, initiate an investigation that is not based on a complaint. So there's really two types of investigations, or what gives rise to an investigation. If we have a complaint that is complex, or we have a cluster of complaints of a similar nature, we can move those into an investigation. That's called a complaints-based investigation. But if we come to learn of a situation in the healthcare system within a sector that's within our jurisdiction, then I can, with my team, in consultation with my team, decide that this is something that there is a broad public interest that we should be looking into. And so through my own initiative, I can initiate an own motion. And that's what that means. And so we will initiate an own motion investigation about a particular issue. We did that type of investigation during the pandemic, during the height of the crisis in long-term care, where we were getting complaints, but we initiated the investigation as an own motion under my own initiative, because we felt that there was the public interest was pretty inherent, that we understand this issue, what was going sideways in long-term care. And so that's in those circumstances, that would be what reaches the threshold of what an own motion investigation would be generated by.
Let's talk a little bit about self-advocacy and also the idea of collaboration within the caregiver space. In fostering self-advocacy, what resources or support does the Patient Ombudsman Office provide to patients, residents, and caregivers?
Well, I think one of the key resources we offer is just the service, because, as I said, we do a lot of sharing of information about the complaints, processes within the sectors that we have jurisdiction, and actually the whole healthcare system, because our team is very skilled in the entire healthcare system, because we have to understand the entire healthcare system to know what's jurisdictional, what's not jurisdictional. And as I said earlier, we look at the whole experience. We just don't think about what's in our particular jurisdiction. So I think that's probably, from an advocacy standpoint, when someone has a question as to whether we have jurisdiction or whether our office is in a position to affect any kind of change, by being able to reach out to our office either through our call center or through our website or through the reports, we are providing information to allow people to self-advocate. And information is power, particularly when you're dealing with, as you said earlier, that sometimes this can be the first time we're experiencing this without, dealing with a particular situation. And so we really don't have a body of work to work from. So advocacy is about knowledge, and that knowledge can come from a variety of ways from our office. So that's important resource to think about us as someone you can reach out to. I think the other thing is, the vast majority of complaints are resolved, and we would never get involved. So we just see a fraction of those complaints. So there is, through your association of caregivers, through peer groups, through PFACs, patient family advisory councils, and just through families and friends, there's a body of work of people who have had experiences with the healthcare system. And I think that's just the nature of caregiving, is you become a sponge for all things healthcare so that you can advocate for your loved one. And so being able to activate those other, sources of knowledge and support is really important. I can tell you from my own personal experience, when I was a caregiver from my mother with dementia, I didn't make as much use of those resources that I think I should have. And in hindsight, it probably would have benefited myself and our family. But hindsight is 2020. And now going forward, I'm much more apt to be able to say, what, I think I could reach out and ask a question. There's nothing to be lost by asking a question, and see if this organization or that organization can help us. The other thing about, because we're an impartial organization in terms of we we try to give advice and guidance to complainants and health sector organizations. Some of the resources on our website, which while they're tailored to health sector organizations, I would encourage caregivers to read, because you'll get an idea of how we are the advice and guidance we're giving to health sector organizations, how best they can work with caregivers and patients and residents. And that gives you the ability to kind of a little bit stand in their shoes for a little bit to understand what kinds of perspective they might have on complaints and complaints resolution. So there's a lot of insight to know the other side's perspective on how to be a good advocate, and little tidbits about how, a tidbit that we would provide to a health sector organization about how best to deal with a caregiver is going to be a good tidbit for that caregiver, because you'll know then what's the motivation behind, why an HSO might be asking a question, and it might be a very good one.
Our online support group offers a community of fellow caregivers who understand the challenges and rewards of your role. Connect with trained peer support group facilitators with firsthand experience as caregivers and share your concerns and successes in a safe and supportive environment. Join us today and experience the power of community. For more information, call 1-833-416-2273. That's 1-833-416-CARE. And now, back to our episode.
That's great. A great point that you bring up, because there are people on either sides of these situations that are striving to do their best. At least that's what we hope there is. So understanding what each side is going through, what workers in the healthcare sector are dealing with on a day-to-day basis, or what they're operating with, is really important for caregivers as well. And I wanted to ask you a little bit more about the flip side of the situation, about how your office collaborates with healthcare institutions to sort of address and or prevent those systemic issues. And I'm assuming that's part of the puzzle right there, your advice for those organizations. But is there anything else that you can tell us about?
Yeah, we're in the business of influencing. Like, we want to influence those organizations we deal with, to recognize that through complaints, we are gaining access to very unique insights. This is not insights from satisfaction surveys. This is not insights from clinical data. This is insights from a perspective that people complain about things that are important to them, and it matters. And so if it's important and it matters, then to a caregiver, then it's important and it should matter to a health sector organization. Yeah. And so that's where we come from. And so in that conversation that we have with those organizations, we are always raising the bar for them to understand, from a fairness standpoint, how things can go wrong. And we rely on a couple of methodologies to be able to do that influencing, because healthcare is a very evidence-based type undertaking. It's highly technical sometimes, and sometimes constructs or methodologies to be able to look at things that seem complex in the outside, but when you actually can break them down and become simplified, help. And so we, in the work of an ombuds, I talk about fairness a lot. Well, fairness to us comes in three flavors. There's the three flavors are substantive, which is decision making, how decisions get made; procedural, what is the process that has been undertaken to achieve something, whether it's to clinical care or whether to do complaints or whatever it is; and the other one is behavioral, how people were treated. And so when we look at a complaint, we look at it through those three lenses, and we begin to deconstruct it into those situations. And so we understand that in this particular part of the experience, that was really a breakdown in communication. Someone wasn't being heard or didn't have an opportunity to ask questions. That talks about the how people were treated piece. Mm-hmm. And that could be the thing that the person is mostly upset about, is the fact that they didn't have a chance to tell their story, to let people know how their loved one was being impacted. That's what sticks with them. It may not be the fact that there's no policy about this particular interaction, or it's a poor policy, or the fact that a decision was made and it wasn't based on the right amount of information. They really could be sitting in that part about how I was treated. And that really just helps us to be able to sort of understand again the component parts, but also get to what's important for that individual, because you can't boil the ocean, right? Sometimes there's so much going on in a complaint that it's really hard to understand, to actually try to deal with all of it. But if you can get to what's important, then that's helpful. So that's how we influence those organizations, is to get them into that mindset of not just seeing complaint first in a negative light, but to realize that through its component parts, you can get to some really tangible, measurable insights that you can use to do a better job or improve quality or improve safety or the experience for patients and families. So that's one of the ways that we influence is by meeting them where they're at, right? They want the information in a way that they can work with it. We also, we don't name, blame, and shame. That is not the nature of Ombuds work. So you'll recognize or see on our website and our reports, we never name the organization. We certainly don't name the individual, because everything is confidential and private. So we are very, very careful never to relay any information that could identify the patient or the caregiver or the individual who came to us. And that really works to creating that safe space to allow us to have frank conversations with organizations about what's gone wrong, which is never an easy conversation to have. Healthcare workers, healthcare providers wake up every morning wanting to help. They don't wake up every morning to try to frustrate someone's life or cause harm. And so recognizing that the no naming, no blaming, no shaming is really fundamental to the work that we do. And so it encourages people to be frank and open with us. And then when they make commitments to us about what they want to do to change, we do have the power, and we call it the moral suasion piece, to continue to follow up on that organization to see where they stand with those commitments. We have no ability in law to compel an organization to take any kind of action that we have recommended or suggested. That's just not the way ombuds work. But we have the moral suasion piece. So we will continue to be curious as to where it stands with that particular commitment they made to make a change based on a complaint or an investigation that we did. And we are pretty terrier-like in that manner, and we continue to follow up with those organizations until we're satisfied that they have done what we think is sufficient to have resolved that particular issue.
We did touch on before the fact that an individual or a caregiver could interact with various different organizations in their healthcare journey, even if it's for one particular issue. So we're looking at situations that can be a little bit more complex. Many of the situations that your office deals with are complex, but if we're dealing with resolving complaints that involve multiple stakeholders and complex healthcare scenarios, are there any additional or different strategies that you would approach that with? Or does it just sort of depend on situation to situation?
Well, what I mentioned about the lenses that we look at complaints, the actual concept is called the fairness triangle. And if someone was interested into that, it's on our website. And many ombuds follow this fairness triangle concept of looking at things through these three domains of fairness. That gives us the construct to be able to actually take a complex healthcare experience and break it down to its component parts, so we can understand the organizations that were involved, the individuals, the actual what we'll call touch points, where there might have been a negative interaction and what transpired in those situations. So that gives us a framework to be able to work with. We also have a very highly trained team. As I said, we understand, we know the whole healthcare system. There's still things that we come across, we think, wow, we didn't quite know as much as we wanted to about that, but we will quickly find out about that particular element and understand it. So we have a lot of knowledge. We're very, I would say, formal in terms of how we communicate. So as I said, we like to communicate in writing where it's appropriate. Sometimes that's not appropriate for all complainants. We want to, do what's appropriate, because that just keeps it organized. And we will also, to make sure that we're not re-traumatizing people, we recognize that we have to be trauma informed in how we do the work. So that recognizing that trauma is on both sides. Not only can a complainant or a caregiver come to us with a very dramatic situation that's occurred, and so there's trauma involved with that. It can happen on the other side as well. Providers can have an experience delivering healthcare that creates trauma for them and their teams. So we're always in that trying to be trauma informed. If it turns out though that we are in an area that requires particular expertise, we will reach out to what we call subject matter experts who have deep knowledge of a particular clinical area or healthcare system, and rely on them to inform our staff. We do that more often in investigations, where if it's about a particular sector and an element of a sector, we will look out for subject matter experts to do that. Also, sometimes cultural, linguistic, or clinical complex situations, we'll look for subject matter experts on those sides. So those are the sorts of the things that we try to do to manage complex complaints and investigations. We're also, while we're not a large team, we also are, I would say, a multidiscipline team, in that we do have individuals on our team with particular depth in certain areas of complaints. And so if a complaint comes in that's sort of perfectly in their wheelhouse, and it would benefit from their experience, then we can do the assignment of that case to that individual. We like to have everyone sort of broadly able to take complaints from any type of sector we've got, but there are times when it's appropriate for us to give it to somebody who really has deep understanding of that situation.
I probably had a time in my caregiving journey where it would have benefited me to speak to the Patient Ombudsman office, and I didn't know about your existence at the time. So I think it's very helpful that our listeners today are going to find out more about the work that you and your team does. And it's also impressively thorough, your approach to everything, which is a lot of peace of mind, I think, for many caregivers. Can you tell us where we can find your organization online?
So we have a website, patientombudsman.ca. We also have a call center that I mentioned that you can call. It's a 1-888-321-0339. And you can speak to one of our, what we call early resolution specialists. And they can, that's where it starts. And it could be that that's where it stops as well, where you get some information and you're able to advocate for yourself a little bit better. After speaking with that, if it is to lodge a complaint, you can do it that way. If you are ready to make a formal complaint, there is an online form that you can complete and submit electronically. If there is a need for some accommodations or some assistance in terms of doing that, then call the office, and we're happy to make arrangements to make sure that you get the complaint in a way that's appropriate for someone's individual circumstances. And so that's the best way to get to our offices, through the online and through a phone call.
Having been a caregiver yourself and now working in the realm that you do, before we finish our episode today, is there any parting words of advice that you might have for our caregivers?
Thing is, I'll go back to what I said. I said about my own experience. I wish I had reached out sooner for some aspects of the care that I was providing my mom and now provide to my father. Working in healthcare, what I don't know would fill a book. So I think that's the nature of caregiving, is that we're in that learning mode always. And if you've got resources like our office and others, reach out to them. It's a low risk way to gather some information and hopefully help you do your work.
And if you don't ask the questions, you might not ever find the answer. So that's
Absolutely.
great advice. Craig, thank you so much for taking the time to be on Time to Talk today. It's been an absolute pleasure speaking with you.
My pleasure. Nice to meet you.
Thank you for listening. We hope you enjoyed this episode. You can access more details about support services on our website, ontariocaregiver.ca. Until next time, I'm Michelle Jobin, and you have been listening to Time to Talk, a podcast for caregivers. We hope you have a wonderful day.